Hi, everybody. It's your friend Shena Collins here with Shena Strong. I'm looking absolutely fabulously terrible tonight, but I just got done washing my face, and so that feels good. I love Mary Kay products. I think, and I'm working on, I'm saving up to get a Miracle Repair set. That's what I really like. Okay. Tonight, I am going to show you how to take the Emgality shot. This is part, for those of you that don't know, or you may know, I am a chronic migraine sufferer. And I mean, every single day, even with treatment, I usually have some form of a symptom of a migraine. And especially when it gets close to taking my Emgality shot. So, I actually, to treat my migraines, I receive radio frequency ablation. So that's where this POC that I always complain about is from. They put rods in and they hit nerve endings and then they fry the nerves. And it makes my head feel like, for roughly about 6 months, like I have Novocaine. Like I don't have feeling in parts of my face and through the back of my head. And then I also receive steroid injections and injections of some other cocktails of things. And I get those in my occipital lobes, down the back of my head, down my neck, and then also in trigger points in my back. And so my migraine treatment is rather extensive. And then on the days when I have a severe migraine where I'm having issues with cognitive functioning, where I am having extreme light sensitivity, where extreme sound sensitivity, I have a backup drug that I take, and it's called elatriptan. And all of this needs to be prescribed by your doctor. I work closely with a neurologist for my migraines, and I've been on this quest to make my migraines manageable since 2012. And it actually started with orthodontics because I had TMJ, and a lot of times you will it'll be the way your bite is, or your teeth are aligned, or if you grind your teeth or clench your jaw, that can cause headaches too because it affects all of this. All right, so that's a little bit of this. Now this is the Emgality shot. And of course, now everything that I do here is not recommended as medical advice. This is me sharing with you what I do, and perhaps it'll help you research, advocate for yourself. You can reach out to me with any questions about things. Now this shot needs to be refrigerated. So when you pick it up from your pharmacy, it will be cold, okay? So the first thing we do is we open up the box. It does come with instructions, a lot of them. But after you've done this a couple of times, the first time you're going to want to read the instructions. But after you've done it a couple of times, it's pretty easy. So this is what the shot looks like. It is one of those safety shots, so it pops back in. But I still recommend keeping a sharps container so that you can properly dispose of these, and then dispose of them however it is with your local ordinances and where you drop off items like this. Okay, so as I mentioned, this has to stay cold. Now, before you use it, you do need to remove it from the cold for at least an hour, okay? And once you unrefrigerate it, you cannot re-refrigerate it. So let's say you pull it out and you forget about it and you're like, oh, I'll do it tomorrow. You can't do that. So this is a time-sensitive injection. And this is an injection that is once a month. And I can tell I'm having a lot of the pain, the constant pain that I have up here. And I know that it's about time to do the shots. So that's what we're going to do. You're going to need an alcohol pad. Now the shot, you can do this in your stomach, or you can do it in your thigh. And I do not prefer to do this in my stomach. I tried it in my stomach one time and it was really, really painful. So I prefer to do the shot in my thigh. All right. So bear with me here. Okay. So I'm going to show you this. So the first thing I want to do is make sure that I am cleaning the spot really well that I am working with. I know YouTube doesn't always like all the medical things I show, so I'm not doing anything weird or dirty here or showing body parts. I'm just showing you my thighs. All right, so I like these prepackaged alcohol wipes. If not, make sure you can get rubbing alcohol that's a 90% solution. Make sure you use sterile cotton balls with it, but these just stay sterile. You want to prevent, especially as in my case, I have a low immune system still from the chemotherapy, so I need to make sure I'm doing this properly. So you just tear that open, and then you take and you thoroughly clean the spot with the alcohol prep pad. So I give it a good rub. All right. And this is important because you're going to be injecting the needle. Now, do not shake the shot. This is something you do not want to shake. All right, so I've thoroughly cleaned the area. And then what you're going to do is you're going to remove the bottom just by twisting. And there's arrows, so it's really easy. You can see in there, that's where the little shot is. So this is really easy to do. And then on the top, the shot is locked right now. And I'm going to turn the shot to the unlocked position. So this means she's ready to go. The button at the top, I push. So I go to the area on my leg that I just cleaned with the alcohol prep pad. I place this on my leg, and you're going to want to push it in. So, because you want to make sure that you get that needle in there. If you don't push down hard enough, you're going to miss. And you want to get this in your body, okay? You don't want to miss. You want to do this correctly. So that's, as you can see, it's a little hard with the shadow here, but this is pressed into my thigh. I'm just giving it a good press. And it's unlocked, so it's ready to go. I need a camera woman to help. All right, so we're in there, and now here it comes. So then I'm gonna hold it down with one hand and push it in. I'm gonna take my other hand, put my finger on the button, and then I'm gonna push. You heard the lock. And then you hear another click. And when that click clicks, you're done. And you know it's used because the button stays put. Okay? I always like to put the cap back on. And again, as I said, you know, if you want to store this in a sharps container. So I just throw that in there. So, and until it fills up. So right now I have 1, 2, 3, 4, 5 months worth of these shots in there. I've been doing the Emgality shot for about a year now, and I think that it really works. So that could be an option that you could explore. But I wanted to show you how the shot works, how to use it. I know that I scour the internet for tips and tricks, but always, you know, read the directions, follow your doctor's orders, and don't use anything that your doctor doesn't prescribe to you. So, you know, if a friend gets it, don't say, hey, oh yeah, try this and see if it works. No, not with this. You don't want to. So it's always under the care and the prescription of a doctor. But that is using the Emgality shot. All right, I'm feeling wiped today. I'm still fatigued from the cancer treatments and being on current endocrine therapy. And I've been working a lot extra lately. I'm trying to get caught up from the last 2.5, 3 years of being really, really sick. And so I'm fatigued. And I work, for those of you that don't know, I own a little retail store in so I've been trying, and I'm working in the store by myself, and it's difficult, but I've been working full days. So my work week technically starts on Thursday, and then I work Thursday, Friday, Saturday. And by Friday evening, I'm exhausted. And so I like to do the Emgality shot at night, and because it makes me very tired, actually, too. But I will feel better tomorrow. I know that. I know that I'm going to wake up and this pain I'm having here will be gone. I am not going to take my backup medication tonight because I want to let this work. Otherwise, if it was not in the time frame for me to take the shot, I would be using backup medication. And this last week, I did use my backup elatriptan like 3 times, which is unheard of. I have not done it. I have not taken it so much since that has been provided as a backup method. But there are definitely a lot of triggers about migraines, and we can talk about those at another time. So a big one is fluorescent lights. They make me really sick. So I try to avoid that. If you've been in my shop, you know that around my desk area, I keep the overhead lights off. And then stress is a big one. And you want to make sure as well, you know, you're drinking enough water, staying hydrated and eating well is also good. And then exercising. All right. I just wanted to show you how to use the Emgality shot. Okay. It's Shena Collins with Shena Strong. If you want to support the Shena Strong mission, you can find ways to offer your support in the comments and in the description. But thanks for watching, and if you're a migraine sufferer, chronic migraine sufferer, I wish you the best, and I hope that you are working and finding a way to find relief. It took from 2012 until it was really just right up before my cancer diagnosis in 2020 that we found a way to really control my migraines and effectively. But be patient. It takes work. It takes advocating for yourself. It takes time. I am literally at the pain infusion clinic and pain management clinic every 2 to 3 weeks for some sort of procedure. But it allows me to function, and without this, I would not be able to function or live some sort of a normal life. Okay. All right, everybody. Shena Collins with Shena Strong. So doing my best to keep strong. All right. Peace and love, my friends. Love to you all. Have a great day, great night, great morning, great afternoon, whatever it is at the time that you're watching this. All right. Thanks for watching. Take care. Be healthy. Don't do anything without your doctor's permission. All right. See you later.